Aaride AGT-1 as a surface detergent spray for central air conditioning vents where COVID-19 causing virus-laden droplets may be displaced by airflows and deposited on the surfaces of the vents in malls, hospitals, office buildings, trains, cruise ships, aircrafts to aircrafts, immigrations, and airports. Two key features of Aaride AGT-1 as in surface detergent spray for central air condition system vents to eradicate the accumulation of coronavirus from COVID-19 patients' droplets. 1. Aaride AGT-1 surface coating spray on central air conditioning vents in malls, office buildings, and public transportation including aircraft and cruise ships to prevent new infections of COVID-19 from coronavirus aerosolized particles accumulated on the vent surfaces and circulated by the central air conditioning. 2. Aaride AGT-1 justification for using active ingredients comprise of a very precious natural plant-based materials ranging from a few hours to a few days. Aaride AGT-1 has excellent virucidal, tuberculocidal and bactericidal properties in eradicating HIV virus, tuberculosis, resistant bacterium like MRSA, eradicated to an undetectable levels, makes Aaride AGT-1 as a suitable solution to be sprayed on surfaces exposed to COVID-19 patients and COVID-19 asymptomatic carriers. Abstract: COVID-19 pandemic has stirred a global challenge to the disease control authorities worldwide within a very short duration of time caused by extremely infectious version of coronavirus. Studies have proven on COVID-19 causing virus have shown similarity of unique inserts in the 2019 nCoV protein to HIV-1 GP120 and GAG. Though the evolution and the origin of COVID-19 causing virus still remains a mystery, the 4 insertions in the spike glycoprotein S, which are unique only to the 2019 nCoV and not other, in view of the global efforts in mitigating further complexities, complications, new infections and prevention of mutation into more virulent strains. Aaride AGT-1 fits the search for a practical and a comprehensive antimicrobial agent with hybrid active ingredients concept with natural biodegradable extracts. Aaride AGT-1 with minimal chemical-based ingredients to ensure prevention, mutation and evolution of newly mutated strains which may impair the global disease prevention efforts. Superior efficacy of Aaride AGT-1's disinfection properties top the list in comparison with most of the brands currently used in hospitals and operation theaters. Aaride AGT-1 may play a vital role in effective disinfection, destruction, and total eradication of newly evolved deadly and highly infectious pathogens in future. We hope Aaride AGT-1 will be made available globally in time to aid the global disease control mechanism well equipped, so that similar pandemics like COVID-19 or other future potential deadly man-made biowarfare viruses in future will be attended swiftly without having to lose many valuable human lives. For now it is our hope that after the movement control orders are withdrawn, when the public heads to office and big buildings with central air conditioning, vents are sprayed with Aaride AGT-1 A7 surface detergent. Air condominium SPTAY to prevent new infections caused by the accumulated viral particles from sneezes and coughs by both COVID-19 patients, as well as the asymptomatic carriers. Introduction. Since December 2019, COVID-19 pandemic caught the global disease control mechanism off guard, and new infections increased in quantum leap starting in Wuhan, China, which coincided with the Chinese New Year festive traveling. It has been an utmost concern among the medical and scientific community in prevention of the evolution of resistant strains and mutated versions of deadly pathogens. As it is COVID-19 causing coronavirus has caused one of the biggest challenge after the Spanish flu, which claimed more than 50 million lives, in view of the concern of creating an effective formulation which successfully destroys the pathogen without causing a mutated and resistant strains. Aaride AGT-1 was formulated with a hybrid of biodegradable and natural ingredients in combination with germicides. Aaride AGT-1 has shown excellent germicide properties on MRSA flesh and bone-eating superbug, which poses a big challenge in the operation theatres and hospital settings. Theatres and the hospital environment. Studies have proven that the microscopic structure of COVID-19 causing virus comprises of 4 protein envelopes from the HIV virus, and it is numerous times more infectious than Ebola virus. It is also proven that COVID-19 transmission can take place from asymptomatic carriers. This makes global disease prevention and disease control efforts more challenging and difficult. COVID-19 causing virus can stay active in variety of surface materials ranging from a few hours to a few days. Aaride AGT-1 has excellent virucidal, tuberculocidal, and bactericidal properties in eradicating HIV virus from viral load of 400,000 copies at ultra undetectable levels, thus placing Aaride AGT-1 as a suitable solution to be sprayed on surfaces exposed to COVID-19 causing virus patients and COVID-19 asymptomatic carriers with high viral loads laden droplets and aerosolized particles from their coughing and sneezing activities. A peer-reviewed study published in the Journal of Tropical Biomedicine, which was highlighted in NIH, PubMed and ResearchGate, has shown Aaride AGT-1 being the most efficient in eradication of the deadly viruses and bacteria in comparison to the rest of the brands of disinfectants currently used in the operating theatres and the rest of hospital settings. Air conditioning systems could spread coronavirus. Research shows that results from swab analysis of rooms used by 3 patients indicate disease may be more contagious than thought, by Henry Bodkin, Health Correspondent, 6 March 2020. Coronavirus could spread around buildings via air conditioning systems or even on a draft, new analysis has suggested after scientists found traces of the virus in a hospital air duct. The results from swab analysis of the rooms used by as few as 3 coronavirus patients indicate that the disease may be more contagious than previously thought. Even though the patient to be responsible was suffering only mild symptoms, scientists from the National Center for Infectious Diseases in Singapore found evidence of the virus in the hospital's air exhaust. This suggests that small, virus-laden droplets may be displaced by airflows and deposited on equipment such as vents. They said, a new piece of evidence published in the journal Emerging Infectious Diseases, shared by the Centers for Disease Control and Prevention, suggests that a more pressing concern might be the role that air conditioners will play in keeping communities safe throughout the warmer months. The newly published study found that 9 people were infected with COVID-19 simply by sitting near an air conditioning vent in a restaurant in Wuhan, China, where the coronavirus was first identified. The study examined how one asymptomatic diner managed to impact diners around their vicinity as infectious droplets were circulated by the air conditioning system. The person in question sat at a table that was located in front of an AC unit. 4 people at the person's table later tested positive for COVID-19, as well as 5 people at neighboring tables, virus-laden small 1M. Potential aerosol transmission of severe acute respiratory syndrome and Middle East respiratory syndrome viruses has been reported. However, none of the staff or other diners in Restaurant X were infected. Moreover, the smear samples from the air conditioner were all nucleotide negative. This finding is less consistent with the aerosol transmission. However, aerosols would tend to follow the airflow, and the lower concentrations of aerosols at greater distances might have been insufficient to cause infection in other parts of the restaurant. Coronavirus sustainability on various surfaces. Coronavirus can last on for long duration on different metal surfaces, ranging from hours to days. Recent studies show that the coronavirus can last about 3 days on a plastic surface as well as on stainless steel surface, It can also sustain, for a period of whole 1 day on cardboard, whereas it can only sustain for about 4 hours only on a copper surface. Aaride AGT-1 uses active ingredients comprise of natural plant-based extracts and germicides called Robicus mph as hybrid ingredients to ensure mitigation and prevention of resistant and mutated strains in the process of destruction, disinfection, and total eradication of the pathogens. Duration of SARS-CoV-2 virus survival on different types of surfaces. The following are the results from a comparative study of SARS-CoV-2 and SARS-CoV-1 viruses are done to estimate their decay rate on different metal surfaces and in an aerosol. They have used a Bayesian regression model to study the decay rate of the virus on different surfaces. Around 10 experiments with different conditions involving the above two viruses were done for 5 different environmental conditions. These include 4 metal surfaces and aerosol. Plastic, stainless steel, copper, and cardboard were the 4 metal surfaces taken to consideration. The reason behind taking these metal surfaces was the use of these materials in our day-to-day life, whether the population is traveling, shopping, or doing work in the office.